Now, in the next several chapters, you're going to learn about each classic cranial pattern of dysfunction specifically, in the way that cranial osteopaths, cranial manual therapists, and even some craniosacral therapists use and define these terms. Now, remember at the beginning of the course, I talked to you about how it would be useful in your practice, why you should learn to categorize things according to patterns, the usefulness in terms of systematically approaching your assessment and treatment. But also know that when you know the difference between a torsion or a side bending rotation or even a compaction or fixed inflection or extension, and I know all those terms just sound a little bit foreign to you right now, but it's good to be able to know that you're using international terminology so that if you're reading a published journal article or a textbook from another part of the world, or even meeting cranial practitioners anywhere throughout the world, that you're all talking the same language. And also learning how to identify cranial patterns is the cornerstone to your assessment and treatment. And when I say it's the cornerstone, I mean that you're going to use that as the basis, like a diagnosis, to be able to decide what you're going to do from here. And a lot of my students have told me that they like the fact that I've set up systems for them. And we know that when it comes to the cranium, we can be a little bit overwhelmed. We can kind of come and have a client in front of us and be like, I don't know where to start. So if you have a system, it can help reassure you, it can help organize you, and it can help you plan how you're going about correcting and treating. Now, before we start identifying the different patterns, I want to just talk to you about some basic principles that govern how we go about defining a pattern. And one of them is that the cranial pattern of dysfunction is defined by what the spheno-basilar symphysis is doing. Spheno for sphenoid, basilar for the occipital base. So we learned in our fundamentals class how the prime driver of the whole lymphatic system, that movement of lymph, that movement of cerebral spinal fluid, and even the movement of blood circulating within the cranium, is pumped by the cranial mechanism, and the fundamental mechanical basis for that is our sphenoid and our occiput. That means that when it comes time for you to first start assessing a client, saying, okay, where do I start? Well, let me start by looking at what symptoms they have, make a diagnosis, and then I can treat. So we're going to be looking primarily at what the sphenoid and the occiput are doing. And we're going to be breaking it down into sections. And we're going to be breaking it down into sections using our cranial chart that we learned how to use in the first fundamental course. And now it's going to become an integral part of your day-to-day when you sit down with a client for the first time and you're trying to figure out what you have in front of you and how you're going to go about correcting it and relieving them of their symptoms. So, one more thing, since the prime driver of the cranial system is the spheno-basilar symphysis, and those are the two bones that we are going to be assessing in order to decide what kind of cranial pattern of dysfunction a person has. Sometimes certain patterns will be shifting a bit to the left or a little bit to the right, and that's going to be defined by what the occiput is doing. So if your occiput is torquing, turning, there's a torsion a bit towards the left side, or if there is a lateral strain where it is side slipping off to the right side, that's going to be determined by what the occiput is doing.